Can you hear me?
Yes.
Okay.
But we have at least form in the room, so we can begin, and we'll have some, clerical matters doing the vote that way. So I think we can begin the meeting, and then we'll hope that more board members will join in. So I'll call to order, and let's have the pledge of allegiance, please. Pledge of allegiance
Pledge allegiance to the flag of the United States of America and to the republic, one nation, under indivisible, with liberty and justice for all.
Shall we have a roll call vote? Roll call.
Chairman Fletcher,
Here.
Glenn Bailey, Duke Johnson, or Dr. Johnson.
Here.
Hi. Peggy.
Here.
And Commissioner Bertling.
Here.
Commissioner Cowles. Okay.
So let's open it up for public comment. Anyone from the public here? Doesn't look like it. So that makes that brief. Consent agenda. Eric?
Chairman, would you like me to provide some detail or?
Sure, Paul. One thing we could do, I guess I did this, I should have done this in the beginning. We could flip consent agenda with ballot tally so that we can be tallying the ballots while you're going over consent agendas. Does everyone sort of agree with that? So that we're not sort of stalled out. So I'm going to take the privilege of jumping down to item 6, and we will, I guess, call for. Have you opened them up, or there's a methodology by which you?
Yeah, Sandy and I will open them up and do the tallies while they're doing it.
Okay, perfect. Well, then can you execute on that?
Yes.
Perfect. And then let's go back to consent agenda.
Typically, Chairman, most of this is just approval of draft minutes as well as division reports. I will be touching on division reports briefly in my update on programs. In addition, this is the time of year that we tend to see subgrants and contracts come through from primarily health and welfare and DEQ. And this is the grants and contracts that you see on this list are representative of that. If any of the board members would like me to provide some detail on any of these items, I certainly can. In the board packet, there is a general summary of what this funding is utilized for. But I certainly take any questions or could go into greater depth.
Does anyone have any questions?
This is Peggy. I did have a question,
Okay.
and it was in regards to the financial report. There was a pocket of money identified as home health funding, and I was just curious about that, the home health funding and what that was for. That would have been on the last page of the financial report, I believe.
Maybe a little more detail. I did review the financial report. Peggy, did you indicate that it was related to home health?
Correct. I was just curious because I thought we were not providing home health services.
Then that's correct. We do not provide any home health services. I don't know if it potentially had to do with a home visiting program.
Okay. All right. That's the only question I had.
Well, I guess the short answer is no, we don't have any home health funding or a home health program.
Are there any other questions? Are there any extractions before we move on to a consent vote? All right, hear none. I'll take a motion for approval of the consent agenda.
Mr. Chairman, I make a motion that we approve the consent agenda as here presented.
Okay, do I hear a second?
I'll move that.
Is there anyone who objects? Otherwise, the record will stand as a unanimous vote. Any objections? Hearing none, it was passed unanimously. Okay, item 6 is the ballot tally for the new board member. Have you got the data ready? Okay, well, Dr. Nolan, congratulations, you're our new board member.
Well, thank you.
It was a close vote. Anyway, do you keep this for your record?
Yes, thank you.
All right. Now, item 7, we're going to have the annual election of officers. We'll, I guess, take them in order as listed. Do I hear any nominations for chair? Okay. Do I hear a second? Okay. Any other nominations for chair? Going twice. It's kind of self-serving. I can't cut off the conversation too quickly. Going a third time. Any other nominations? Well, given that, then I guess, should I do a roll call vote? I don't know. It's unanimous, I guess. Oh, good. I'm hearing a yes from a commissioner who's, did she? Okay, fair enough. Thank you. I do have some remarks to make, but I want to save those remarks until the other officers are in place because I want to move on to the business. So, Vice Chair, are there any nominations?
Nominate Dr. Duke Johnson. for Vice Chair.
Do I hear a second?
Second motion.
Okay, we have a motion and a second. Are there any other nominations for Vice Chair? Going second time? Going a third time? Okay, well, Dr. Johnson, congratulations. Now we are going to open up for the trustee of the Executive Council. Do I hear any motions for a candidate?
Nominate Lynn Bailey.
Okay, do I hear a second?
I would second that.
Okay, all right. Are there any other nominations for trustee?
I'd be interested in your role in this, getting a seat for that.
Do we have a second for Dr. Nolan? So I will take this opportunity to step down as chair, if permitted, and I'll second the motion, and then we'll have a roll call vote. Do I hear a third nomination? Okay, then, well, let's see how I guess we'll have a roll call vote per person. Is that how that would be? I guess, I've never done this thing. And then, if the first, okay, so let's, Glenn Bailey was the first one. one, so let's have roll call vote for Glenn Bailey. Yes, yeah, you'll name everyone.
Okay.
Okay, shoot,
Chairman Fletcher,
no,
Glenn Bailey,
Yeah.
Dr. Johnson,
No.
Dr. Nolan,
No.
Commissioner Bertling,
Yes.
Peggy Kamala.
Yes.
well, that's 3 and 3. Well, we do have another board member, through the wisdom of the state legislature. They put 7 of us, but we're missing someone. So I mean, I'm open to whatever people want to do. My friendly suggestion would be to, I don't know, wait, call her up, see if we can, I mean, we can't settle it with 3 and 3. I'll bow to the commissioners. Well, you guys have more experience with this than I do. Except there's always 3 of you too.
Glenn's been in that position before, and he knows the ropes. He gets ready for it on. He will be executive council, and that's why.
No, I understand that, but we have a split vote. So
Well, they-
how do we get out of that paradox?
Table it. Table it.
Table it, okay.
Yes.
We can table it. All right, until next meeting then? Okay, then we're done for the time being with election of officers. I had said I wanted to make some remarks. I'll keep them very short. Since we have many new board members, I want to reiterate what I had said last year so that everyone understands. I am a firm believer in freedom of speech. So any board member is invited to contribute to the agenda on any given board meeting. I think the rule is 3 days beforehand. So as long as it's 3 days before, I think you guys have the same rule. And I invite that. Parenthetically, when I was not chair, I was actively censored, and that disturbed me. I didn't think that was appropriate. So I'm going to go out of my way to guarantee there is no censorship in this room. I invite a dialectic. So everyone understand, all board members, you are perfectly welcome to introduce any topic you wish. Now, having said that, I do have one favor. And this will include you, and that is if someone puts an executive, what do you call it when it's in closed? Executive session, yeah. If someone places an executive session item, I would ask that you give me a call. I was ambushed once this last year. I don't want to experience that again. And so if you put an executive session item, you can't disclose what it is, I get it, but you can disclose it to me. Now, I'll still let it happen, but I don't want to come into a meeting and not know what's on the agenda. Can I do this legally, guys? How does it work in your world?
You usually would pick what executive session you're going to go under, personnel, and or land acquisition, private property.
Right.
That's how you would go into exec session. There's times I go into exec session, I have no idea what's going to happen. I know what it's about, what categorization it is, but I don't know what it's about.
Oh, that's interesting.
Yeah, but you should be able to name a general topic, litigation, so that we know what we're gonna discuss. But you don't say
Legal.
If you
There's-
don't
there's-
say who's involved with it, you don't say that's all in exec session.
Okay, well, good.
There's-
Thank you for
there's
telling me that. One other question. Is that Peggy?
There are, yes.
Go
So
ahead.
I have my hand up for a question prior to this. So, but there are categories for executive session, and I know one is legal and one would be any personnel matters. I know of at least three. I can't think of the third off the top of my head. But when we're finished with this, I did have my hand up for a question as well.
Oh, yeah, you can talk. You want to say something?
So I wanted you to be able to finish what we were talking about, and then you can come back to me, but I just wanted you to be aware that my hand is up
Well, I'm
for a
sorry.
question.
As it happens, my face is being oriented towards the bulk of the room, and the screen is behind me, so I apologize. Jessica, do me a favor. You'll pay attention to her hand and let me know that she's raising her hand, pretty please.
Yes.
At least I think it's up.
Believe me, it was not deliberate to ignore.
Oh, I understand that.
Just has to do with the dynamics of the room.
Peggy, your hand didn't raise.
Oh, it
so
didn't?
if you
So,
if you put it in the chat, I'll keep an eye on that as well too.
okay.
Oh, there you go.
Oh, there-
Okay, thank you.
So I was being accused of not recognizing the hand and there was no hand. Let the record stand, there was no hand, and that I do not have ESP.
Well, maybe I'll have to turn my video on and then just raise my hand.
You are welcome. Okay, let's go back to the executive session thing. So if I understand correctly, you can know the category, but not the specificity. Okay. Now, can you find out who requested the executive session? And are there, shall we say, rules as to what topics can go into executive session versus what topics must go into executive session, and who gets to make that call?
If you're talking about personnel, then personnel, any person's name are going to be brought out, that has to be.
Okay, got it.
You can't talk about, call people out in the session.
So that would come from Sandy, I guess? I mean, who makes the call?
Mr. Chairman, if I could add a comment, and in particular, I think to the issue you're raising is that executive session was identified as appropriate by legal counsel. So it's my understanding that the board had asked legal counsel to provide review of the agenda, but otherwise not participate in the meetings. So I guess two comments. One, you're correct that we don't have to notice the meeting, but 72 hours prior to. But I believe that the board had wanted to at least have a draft agenda to legal a week prior to identify if there was any need for their participation or if any item potentially needed to be completed under executive session. So
And so they get to call for executive session?
well, I think that if they identify concerns that it may need to go to an executive session, they would need clarification from yourself or from the board member that's requesting that item to determine that if executive session is necessary or not. I think that they're trying to protect the board.
Okay,
in the
so
discussion.
I got that, but you just said something. Your last sentence is key. If legal is going to call for an executive session, then they can't do it unilaterally. They have to vet it through either the board member who requested it or me. Is this in concert with your protocols?
Well, if you're going, you break it down the fact that if you're going to talk about personnel, any person thing, it has to be executive session. If you're going to talk about legal, that has to be in executive session. Everything else is fair game.
Okay, and when you say legal, would that be, again, general versus specific? So on the occasion when we were ambushed, it was a very general legal question. It was legal theory as much as anything. It was not about a case. Does legal get to then determine, we're going to go into executive session to talk about legal theory?
It
Has to come from the
It
board. Do
should
you
come
hear
from-
that?
It should come from the
Okay.
board, and then I would say then it should go to them to where they can say, yes, that should be executive session, or no, that should be executive session.
Thank you.
If a person thinks.
Commissioner Corn.
So I would recommend the board, especially the chairman, look up road that each board has to do. That's where we talk about state road, what we're supposed to do with board, other issues, what we can do in executive session for. We're going through budgets right now, which is not about budgets, but we're not supposed to stay there and about their if you have any reviews, that was something that you do in the executive session. But everything you really want to do that wisely because you want to show people that you can afford it. Past boards of our county that have used it, they will go into executive session because they want to talk about something that they don't have anybody to do. That's illegal.
Right. And that's what happened the time we were ambushed. I don't want to have that happen again. And that's correct.
And it's very limited.
So I can give pushback to the lawyers when they say, oh, we're going into executive session. It asks them
Yeah.
why, and then they have to generate a reason. And if we happen to disagree, I'm going to bring it to you guys.
Yeah.
I'm going to let you tell me whether we should take that topic into executive session. Is that fair? Okay.
Can I make mention on 74206 it Commissioner mentioned on, I think it's section F, talks about to communicate with legal counsel regarding litigation or legal risk of current and proposed action. So it's a very specific thing, but it's maybe not just a general thing. So that is one where if we needed to talk to them directly, privately, but together, right? And then we need to come out of that quickly. Fix that.
Yes, and then you don't have that executive session, and that's what the vote.
Yeah, Right.
Yeah.
right.
Well, now I understand the principle of executive session as it relates to litigation and personnel. And there may be some other topics that are particularly sensitive, and I appreciate that. But to use it as to cloak a conversation where you don't want the public to hear what's being said strikes me as contra to the principle of free speech. And people should,
We're not following. You guys are following that.
I got it. But please understand, Commissioner Corn, I am an advocate for openness. Okay, any questions about my style here? I invite everyone here to submit topics. Peggy, that includes you. And now that we've mentioned your name, do you want to say something, Peggy?
Yes. So I just, I always have the process questions, and I have served on public boards. And of course, my experience is with a different board, but I was just curious. I know there's nothing in the bylaws that outline the process for elections. So I would like to hear from other board members what the process has been. And I would also like to know if at any time, I guess I would be addressing this to Glenn because I think he's been on the board the longest. And also if there has, at any time in the past, has the process for elections been outlined in the bylaws, and has there ever been a nominating committee that kind of takes care of some of the work for the process of election of officers?
I don't have sufficient institutional memory to answer your question.
I thought Glenn might have some
Mr. Chairman,
Sure.
information.
Peggy, in the past, it's been very informal as far as the elections. We have nominations here, and seconding, we follow the proper procedures. But there's hasn't really been any campaigning for positions or those kinds of things in the past. I've been involved with boards since 2014.
Okay,
During that 11 years, I haven't seen anything. That-
okay. I just, the public board I was on before, I think our bylaws were much more extensive. And, there were several committees where work was done in committees and then brought back to full board. So I just was unsure. It seems like there might be some gaps in our bylaws that possibly need to be addressed.
Well, you are certainly welcome to bring that topic up for discussion and even submit some ideas.
Okay.
Okay. Any other questions on this topic? Barring none. The next topic has to do with medical director, and I will turn it over to Dr. Johnson.
Thank you, Mr. Chairman. The topic of medical director was approached earlier in our during this year because of the thought that having a more closely associated and informed medical director, should there be decisions necessary going forward in the future, it would make sense that that someone closely associated or very well aware of what's going on and on a regular basis with Panhandle Health seemed to be a wise idea at the time to us. Again, we come from the position of not extensive experience, and so legal gave their impression that there would seemingly be a conflict of interest if a board member was also medical director, that there could be that perception, though it's not illegal to do so, there could be that perception. And I also spoke with legal's senior partner about the topic, and he was in agreement with that. So the legal firm has asked if I would be willing to step down from that position or keep that position and step down from being a board member. And I expressed that I would I prefer to be a board member and step down from the medical director position, which I guess I officially do at this very moment. So then the next step would be a discussion on, well, what's the future direction? How do we go from here? And it's still, we've had, I mean, if it comes where the medical director needs to make decisions which are influential to the health of the county, but not necessarily informed as to what has been going on in the county, what the resources are at Panhandle Health, what the infrastructure is and the capabilities, and someone who is not necessarily associated to any great degree, I'm not sure that that would be in the best interest of Panhandle Health or North Idaho. So I have been thinking about this position and thought that perhaps what we could do would be to, open it up to non-board members, of course, which is what legal recommends, but then have that medical director be part of a subcommittee of the chairman, so that in essence they're an influential member of a medical director subcommittee per se, so that those that do have a medical background who are closely associated with Panhandle Health could also weigh in to decisions that may be made in the future, so that it's not just an outlier individual, but almost per se a group decision of a subgroup. So that's kind of my suggestion going forward, and I just wanted to bring that topic up and those ideas.
Is it also true that the lawyer who founded the group that we have legal contract with is the one who came up with this architecture? Well,
Perhaps in our in our discussion, I'm not exactly sure who came up with it, but it seemed to be a reasonable solution.
But he blessed it.
He seemed to think that that was
So in other words,
a
the
reasonable
legal
solution.
blesses your methodology.
Right.
So let me see if I can.
I mean, that's my impression. I don't want to speak for him, but that's my impression.
So if I understand correctly, for the sake of having the optics that we're above board and not doing anything shady, we're going to have an outside employee serve as the medical director. But that human being will not act in isolation, but in fact coordinate whatever medical policies are deemed appropriate in concert with a standing subcommittee of board members.
Mhm.
Is that,
Mhm.
is that a fair
Yeah.
encapsulation of the
Yes.
methodology?
Yes.
Does anyone have any questions regarding this methodology?
Chairman, just one question. Is there a reason that individual wouldn't just do it in concert with the board as a whole versus a subcommittee?
I don't understand your question.
My thought is that if a subcommittee, is also a public meeting potentially, and any issues that come to the board for consideration requires the input of the medical director, why would that medical director not just report to the board as a whole, to all seven
Oh, I
members instead
understand.
of?
Okay.
I think I can answer that. Because I think the whole idea was, and that's not, again, medical decisions, it would be wise for medical decisions to be most influentially made by those with the strongest medical background. And so there are members of the board that don't have a degree in medicine, and a lot of these issues are very complex. And as we've experienced in the last few years, there has been a great deal of controversy. And I think that when those who do not have a medical background, they have a tendency to lean in the direction of whatever national organizations would say, or their preference, or what they're hearing in the media, but don't have the independent training and analysis to say, apart from what is being spoken nationally, this is what is best for the people of North Idaho based on this science. And so that's why I think a subcommittee is more influential and protective and more powerful for the people of North Idaho, which is whom we serve.
I would add to what Dr. Johnson just said, that bear in mind, it's embedded in the bylaws we implemented December of last year, that should it arise that there is a difference of opinion, then final adjudication is by the board at large. So even if you had a standing subcommittee, it's not like those individuals can go rogue. It's not like those individuals can go rogue. They still have to be accountable to all seven of us. Does that answer your question? Are you happy? The answer?
I think Peggy has her hand up.
Okay.
Yeah.
Peggy, you have a hand up? Go ahead.
Yes, I wanted to, well, and I think Dr. Fletcher, you maybe answered my question, but to me, the subcommittee can meet, but again, it goes back to the board, right? The subcommittee, again, this is my understanding from previous boards, and I'm not talking about, with physicians, but
Yes, the subcommittee cannot.
it's back to the
Act in
board, and the board
isolation.
has the final say.
No, it is not. Per the bylaws.
Peggy, is there a question about what would be the authority of the subcommittee to do or not to do? And like what would need to be brought to the board versus
Correct.
not? Like what level of decision? Like if you're in a business and you allow your staff to spend a certain amount of money, but above that, they have to come to you. Is it that kind of similar concept? Or just everything comes to the board?
Well, I'm just talking about my understanding of how I've seen committees function, and subcommittees meet to do specific work, but then when it comes to major decision making, it still goes back to the board with recommendations from the subcommittee. That's, again, I'm just speaking, that is my experience of what I have seen with committee work and board responsibility.
As the one who is the architect of those bylaws changes, let me tell you what my intention was. The intention was that the medical director would make recommendations, and 100% of them would have to be approved by the board. In other words, there can be no medical director or subcommittee who can potentially go rogue. Does that answer your question?
Good. That was my intention as well.
Okay. Thank you for bringing that question up.
Yeah, and the whole idea was to be in complete agreement with that. The idea, though, that one person who isn't necessarily associated with Panhandle Health is asked to make a decision and is completely separate otherwise, I think that the chance of the information being solid on a consistent basis would not be as strong as if there was input from two other board members who may have medical backgrounds so that they can discuss it as a group. I think there'd be a more powerful and consistent feedback to the board rather than saying, well, I wonder what this medical director is going to say and how they arrived at it, because there may be some who would disagree without having had a prior discussion. That's why the whole idea of the subcommittee.
I think it makes perfect sense personally. But Peggy's point is also reasonable. I mean, I think both positions. Okay. Any other questions about this?
Well, this is Peggy again, and I know I am only a nurse practitioner, not a physician, but I do have some public health background. So I just would throw my hat into the ring if I would be allowed to serve on a committee as a nurse practitioner with many years of public health experience.
Okay, duly noted. Commissioner Ford?
Yeah, I just basically want to look great. We come to these meetings quite frequently, about 6 or 8 months ago.
We've noticed.
It's hard to miss. But I would just like to say that in the business that we're in, as county commissioners, we have many advisory boards and committees that are underneath the board of commissioners, such as War Organization Committee. And those are strictly advisory boards or committees, however you label them. You direct them in the direction that you would like. I can ask them to research this, that, or the other thing. Please come back to us with a good consensus. They can give that to the board, but they don't have any full play on the board. It's still the board's authority to listen to their information, make a decision based on what they think is right for Panhandle Health. And I think that was misconstrued months ago when we were talking about putting together other committees. I think there was a misconception of people thinking that those people might have some kind of pull or authority above the board. So significant. I think you guys make it very clear that no matter what committee or advisory board there, you guys build in the future, all of those need the board. They don't have any authority in their board. That needs to be clear among all the members so that with these concerns with rest, that there's this advisory.
Amen. I think you stated it well. That's certainly my intention. That's the only, in fact, that's the only way it can be. It's just a subcommittee that makes a recommendation and you guys vote it. That's structurally, statutorily the way it works. I thank you for saying that. Well then, sure. Oh yeah, sure.
We are witnessing the evolution of artificial intelligence. And we could be asking several different artificial intelligence providers these questions. It would be incredible to see their input witnessing something.
Wait,
that is
let me see.
evolving so rapidly.
Let me see if I can state your case. Or are you recommending that in lieu of a subcommittee, standing subcommittee, that we would employ AI to serve as the counsel for the outside medical director? In other words, some combination of medical director and AI would make recommendations and come to the board with those recommendations. Is that what you're suggesting?
I see it as a valuable tool in this.
But would this be in addition to or in lieu of the human beings?
To me, a subcommittee takes time, effort, and their product is valuable because I don't know a whole lot about that commission. But at the same time, I can go to the AI with these questions.
I got it.
If
Okay,
an AI
so,
is incredible, what
okay, so there are two possibilities here. Humans and computers, if I were to sort of reduce it. Does anyone else have any comments, questions?
Yeah, I do.
discussion?
Yeah, I do. Although AI has some impressiveness to it, I don't. I've also read a number of writings produced by AI that it's I'm trying to find the right words. I think it can be sound incredibly intelligent, but be potentially misleading, because what that can do is because of that, and then also to think that a computer can replace a practicing physician, for example, myself, who is seeing North Idaho patients on a daily basis, where I know it's happening pretty much every day and what's going around and what things are going through. That's not going to be entered in at some central place, in New York or Silicon Valley or wherever they're doing this. To say, well, what's going on in Coeur d'Alene, Idaho, and I think for us it sounds exciting and impressive, but the reality is you don't want a general that's not in the field. I think that's probably a good parallel to war.
I see it as a valuable tool to evolve something that should be evaluated by practicing doctors.
Any other comments as it relates to this battle between man and machines? Terminator is coming, sir.
So I would just like to say real quick that we're dealing with this at county level too. AI looks very appetizing, I guess if you will. But we have to remember that what goes in is all going to coming back out. It's not a replacement for the power. It's not a replacement for experience. If we ask it for something, we don't ask it for instructions, for behavior, that, that's information. We're putting together policies now, and I think it's a valuable tool, supplement, not to replace. But if you guys do entertain using AI, I would suggest something like, whenever you do use AI, that it's loaded, what you use it for, so that when the information comes to the board, this information came from AI, this information came from the committee, so that you guys understand where it came from, stuff to use. AI, I don't think is to speed for what North Idaho wants or needs. So it can't just be that, it's bringing in worldwide very helpful.
So it strikes me that there are no, oh, I'm sorry, please.
No, that's
Dr.
okay.
Nolan. No, please.
Being the new guy here, part of it is what is with the medical director. What's the main job description too for the medical director as far
Oh,
as?
well, we have that.
Yeah, and I can read it later if that's.
No, it's
yeah.
detailed and it's
Yeah.
embedded in the bylaws.
Okay.
and it is rather detailed.
Okay, I'll read. through
So much so that this guy made me throw a bunch of it out.
it. Okay, that'll help me. I'll get up to speed on that.
Right. Any other questions or comments about this topic? Tim,
Nope.
okay, well, let me make an editorial here, if I may. Certainly AI, I mean, I'm myself even using AI more and more, although I assiduously do not use it for my writing. Because I don't want it to replace my brain. I want to force my brain to construct sentences. But it's an awfully handy tool for like a souped up browser. You know, what's the population of Crimea? I don't know. You know, Grok can tell you awfully damn fast. So if it's discrete morsels of information, it's awfully handy. But for analysis, I'm not going to go there. There are people who do, and I'm not going to make any moral judgments on those individuals. How I would imagine the methodology that Dr. Johnson has articulated or is proposing is that if the subcommittee or even the medical director themselves wants to employ AI, fine, go for it. And I particularly like your recommendation, and that is if you use AI, please disclose it. I like that. Because there are a lot of people who are writing articles now, and I got to tell you, I start smelling, wow, this seems awfully hackneyed, awfully stereotypical, and then I go, I lose faith. Now the other authors will disclose. They'll go, okay, this is what AI said, and they're honest about it, and then they come back and sort of editorialize on it, and that's okay. I can dig that. So I would highly recommend, if we are going to stick with human beings, and they use AI, they disclose as much. I think that's a very strong point. Any other discussion? Okay. This is an action item. I'm looking for a motion.
I guess I'd like to make a motion that the medical director position be chosen from a group of applicants that are non-board members, and that position will be part of a subcommittee of the Panhandle Health Board as directed by the chairman.
Okay, do I hear a second?
Second.
Yes. Oh, yeah, sure, go ahead.
Well, I think that we probably, that's a great question, and I think that we would probably get more attention from the community and more solid input if there was some pay involved, if possible, to budget for that.
It has to be a licensed position. This time is valuable. We pay for our legal advice.
Mm-hmm.
I'll
Yep.
tell you what, if we ask for a volunteer, the medical director will ask for a lawyer to be a pro bono.
Mm-hmm.
Question on that too. Do we know approximate hours per week that we not to be for that?
Well, we actually been through all this once when he
Yeah.
was,
Yeah.
and we hashed it over and over and
Yeah.
over. And it stands to reason that in the first few months, as the person is trying to figure out what in the world is going on, they're going to be more hours. As you reach a steady state, the number of hours are going to taper off, become negligible. So it's my memory that we had agreed upon $300 an hour to be billed per hour. Keep track of your hours. We understand that in the beginning there may be more hours, but 6 months from now, there may be 1 hour a month or whatever. And now that topic then comes up, well, do you have the money in the budget to handle this? Well, we'll work it out. I mean, we'll be mature about it. I mean, when we hired a law firm, we didn't say, well, do we have enough money in the budget to hire the law firm? I mean, I think Tim is particularly sensitive to breaking the budget. I remember this was a question he asked when this came up before, and we'll have to be mature. I mean, we're not going to break the budget with the medical director. But I agree with Dr. Johnson's observation that if you're looking for pro bono work, you may not get the caliber of person that you want to be your medical director.
Mr. Chairman, if I can add something to the conversation. Because of the prior discussions that the board had, we did set aside $18,000 in the FY26 budget for the medical director, based on those approximate hours and so forth that were discussed by the board.
Well, terrific. Thank you. Thank you for that. Okay, that should make Tim happy. Oh yeah, sure, Peggy, go.
Yes, don't we have a current, do we still have a physician that is working for Panhandle on a part-time basis?
We have someone who has an MOU, but that is we can dissolve that MOU without cause at any time. And what we're discussing right now is substitution of, I guess it's Kootenai County Family Practice Group or something. Who's the MOU with?
Chairman, that is correct. To maybe elaborate on that response, we also have a relationship with Kootenai Health, whereas they provide a physician in our offices twice a month, and we pay them so that we have enhanced services. So we do have at least a paid physician in the clinic for doing clinical work 2 times a month.
Yeah, but that human being's not a medical director.
No, understood. I'm just.
Peggy's question is, do we have a relationship with an entity that serves currently as medical director? And
Well,
we do, but we've never. I don't even know the human being's name. We've never seen him.
Well, so my question, Dr. Fletcher, was more, is there a physician associated with Panhandle Health? Because when you had made the comment that if the medical director was hired, it would take them more hours to become familiar with Panhandle Health, and that is why I was asking if we already had a physician who is working with Panhandle Health, and maybe it might be, good for the board to meet this person and talk to this person, because it would make sense that they already have some experience with Panhandle Health and some of the public health programs.
Okay, well, you make a cogent point. We haven't come yet to the point in the discussion of the methodology of how we're going to go about finding this human being. Why don't we pass the motion, and then we'll come back to your question. Your question is legitimate, but can I put it in parentheses, and we'll tackle that in about 3 minutes. Is that okay with you, Peggy?
I'm sorry I missed a bit of that content, because I'm up the river and my Wi-Fi so if you could just repeat what you had just said, because I missed about half of your comments, so I apologize for that.
Okay. Your point about fundamentally, your question is, how are we going to go about finding a medical director? And you're making the friendly suggestion that we might actually want to pick a personality who's already on board. I think your point is strong. Now, what I would ask is, why don't we pass the motion, and then the next thing we do will be to discuss the methodology of how we go about picking the person. Is that okay with you?
That is okay with me, but before we get there, I just want to understand, because the motion was the medical director position will be chosen by the subcommittee. And we had previously identified that that would be with board approval, correct? And I did not hear that as part of the motion.
Let me say this. There will be a search committee. That search committee is going to vet all kinds of personalities who would be potential candidates. They are going to come to the board with a recommendation. The board will vote to ratify that recommendation, to the point that the board may say, you know, that is a totally unacceptable human being. Go back and find somebody else.
Okay,
Does
Good.
that,
I just,
the subcommittee
I-
cannot
Yeah.
unilaterally pick a medical director, any more so than when we chose Dr. Johnson to be the medical director. He had to suffer an at-large vote.
Yeah,
Yeah, and
I don't think that,
I just want to say it was not part of the original motion, and that is why I had brought that up. So
Yeah,
I
I-
think we're all
Well,
on
but
the
it's in the
same page.
bylaws. It's actually impregnated in the bylaws of the medical director that they are chosen and operate at the discretion of the board. They
Yeah.
are subservient to the board.
yeah, the medical director position would not be chosen by the subcommittee, but would become part of that subcommittee once chosen. The medical director subcommittee once
But
chosen.
her point is, there's two issues.
Right.
as I see it.
Right,
The first issue is how do we launch the ship?
right.
How do we get said person?
Hmm.
Then the second issue is how will that medical director interface with the two board members if the three of them constitute a standing subcommittee?
Hmm.
In both instances, all decisions are at the pleasure of the board at large.
Hmm.
Make no mistake, the board makes all decisions. There will be no rogue behavior. Any questions? Yes, Commissioner.
If I may. So I think included in the motion, you might want to put the financial part in that same motion. And since it sounds like you guys have 18,000 years budget for this already, it may be wise to think about putting in there that this is a $1,500 a month position.
Oh, and I would have it on an hourly basis?
The hourly thing, I think you're pretty sticky on billing and everything else. Just an opinion that you may want to hear.
Well, that's
We have medical directors, like on our head district board and such. This is what that next amount of month. That's those kinds of
Tim, what's your take on that?
Well, I think it's back to this, we're just going to basically apply a monthly cycle. But if you could say, you know, up to 18,000, and just once we hit 18,000, then we've got to get back. I mean, because if they're not doing a whole lot, then we're not going to have them for a while.
Yeah.
Yeah,
So, I mean, it's up to the board.
I think, Tim, you have a good point. I think part of it is like you're saying, you could have a boom and bust kind of thing going on, and if something happens and they're more involved, they could be done in 4 months with that money, and then versus if it is more kind of like a stipend thing, and long term it's not expected to be that much, then you kind of cost average and say, okay, we maybe pay them every month, but knowing that there'll be times of, and I don't know, we can look historically and see like what's been like the most, the other times when they're like, hey, I got to put in 12, 15 hours this month, and then other months, 1 or 2, you know, and then kind of just say, okay, we know that we may not get, but we're also reserving, it's kind of like a retainer, you're reserving access to that person. So though you might not be getting hourly that month, you're reserving access to that person saying, I'm going to be there when you need me. So there's different ways of looking at it that way too, but you have lots of good points. So.
Well, speaking for myself, and you guys will make the final decision. Quite frankly, I'm sympathetic to both your positions. I kind of get what you're saying, but a little bit I actually agree with Tim. What I would do is put a ceiling. We're not going to spend more than 18,000, period. And then let the person put in hours, and they may only end up spending 10 of the 18,000. In which case, we don't have to be spending money needlessly. But I don't live your life, and I understand the logic. In the case of a medical director for an EMS, that's an ongoing thing that is going to require many more hours. And it's more regular hours as opposed to, or even the coroner's office. You've got people that you've got to have who are on salary, who are going to be doing things all the time because there are always dead bodies to process. Whereas this project may end up being more episodic. In other words, you may front load a number of hours and then it kind of mellows out and then you don't really do a whole lot, except maybe once a year review some policies or whatever. So that's why I kind of like Tim's approach, but you guys vote on it.
I mean, my gut feeling that I love the simplicity, and that's how I think most physicians would prefer going, because then they don't have to keep track of hours. It's a booger to keep track of hours. Did I spend an hour and 15 minutes or an hour and 20 minutes? How do I list this? But I, maybe as a trial basis, I can redo the proposal, but as a trial basis, when we don't know how much money is involved and we'd hate to waste it, that I can see where there's going to be more at the start and less later. And somehow it's hard to justify wasting money potentially too, and so hopefully the person who takes that position understands that this is our first year, our first shot, and we might run out of money, and please don't abandon us.
As I recall, when you were going to do it, you were going to work pro bono for 6 months. Remember that?
Yeah,
As a
yeah.
consequence of Tim's question.
Yeah.
He said, how are we going to pay you?
Right,
And you said, well, I'll do it for nothing for 6 months.
Right.
But have a budget for it next year.
right. And by golly, I still haven't been paid though.
Okay.
And I was still willing to help, right? Yeah.
All right. So you want to make an amendment to your.
Yeah, if I can, please help me with filling in all of the pieces now. The medical director is chosen by the Panhandle Health Board, and that individual is not a board member. And to be, once chosen, become part of a medical subcommittee as appointed by the director, and will be reimbursed on an hourly basis of $300 an hour up to a maximum of $18,000 for the year.
Now, does that require a second? I guess so. It changed so much. Do I hear a second to that? Okay. Any discussion?
So we have the job description.
Yeah. Oh, that's in the bylaws. Oh, yeah. We vetted
I
on
want to simplify things for HR,
Oh, good point. Okay. We'll post it. Well, we're going to come to that discussion in just a second. That also relates to Peggy's question. Any other discussion? Yes, sir.
Hearing with what we were doing? No, in other words, we just established the position, and then there was immediate feedback that there was conflict of interest, therefore maybe you shouldn't be. So it was kind of like everything was brought to a halt because of legal's concern. Oh yeah, it's
For all practical purposes.
so yeah, it's kind of like, oh well, you guys made a mistake. Okay, great. So it was put on hold.
Moreover, the person that he would have been working with, who sort of the staff who was in charge of the clinical services, she quit. So not only did, I mean, not only did legal say you can't do it, but then who would he work with? I mean, it was chaos. So, his only time that he spent effectively is in this room. Okay, any other discussions? Shall we take a roll call vote? Yes.
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 Okay, then it's unanimous. Now, there are two more issues to address, and they've already been sort of touched upon. The first has to do with the methodology of how we're going to choose this human being. Here's what I would propose, that Panhandle Health put out an post, an APB, however you find employees. I would also invite, and Peggy, if you're listening, any board member who has their own recommendation, say your own favorite doctor, please. I mean, I don't know, you must have a doctor, Tim.
I'm not gonna have to come down here.
Well, but you get the point. Anyone who has a physician, they have to have a license to practice medicine in the state of Idaho. Submit the names. I guess Sandy or Eric will collect the names, however that works. And then once we have a few of them to talk to, then I'm going to appoint not a standing committee, but just a selection committee that will expire once the exercise is finished. And that committee will consist of Drs. Nolan, Dr. Johnson, and Dr. Fletcher. So the three of us will vet the candidates. We will make a recommendation. We will bring the recommendation to you. You do not have to accept the recommendation. You can say, nope, go back to the drawing boards. So, again, I'm not trying to go rogue here. The board still has ultimate authority, but we're at least going to vet all the people and talk to them and look at their backgrounds and their credentials and whatnot, and then make a recommendation. Now, that doesn't require a motion because, as I understand it, it is the discretion of a chairman to appoint a subcommittee of board members. Legal told me that. Did you hear that? Legal told me that. The second issue, any questions about that methodology? The second issue has to do with then the standing subcommittee that is required by the motion that was put forward and passed unanimously. And for that purpose, I'm going to identify two people in the room who will be a part of that standing subcommittee, who will work in concert with the medical director as to what policies should be good or bad or whatnot. And again, remember that triumvirate does not act in isolation. It still has to come back to the board. And that subcommittee will be Drs. Nolan and Johnson. There you go. Yes, sir.
Question. What is your guideline for bylaw requirement?
There's only one. Yeah, that's a good question. A license to practice medicine, and that's an excellent question. Now I'm going to have to beg ignorance. Could a chiropractor? They have a license to practice medicine. In 1973, when the statutes were created, it simply said, it's just one line that says a license to practice medicine. And the truth of the matter is, the state legislature may have massaged what that licensure is since 1973. I'm going to beg ignorance. I don't. Well, obviously, if a chiropractor makes application or a homeopath or whatever, we'll have to dig into the statutes to find if that is sufficient to serve as a medical director. Now, bear in mind that our nurse practitioners write prescriptions. So right there, the Controlled Substance Act of the FDA is going to weigh in on who has the authority to give guidance or direction, if you will, for nurse practitioners to act as doctors. You see what I'm saying? The chiropractor, my guess is that I know for a fact in the state of Texas, that's where I practiced for 42 years. I've not practiced medicine in this state at all, so that's why I have to beg ignorance. In the state of Texas, osteopaths and allopaths have that license to prescribe the whole list of scheduled drugs of the FDA, but not chiropractors and homeopaths and whatnot. Sandy, do you know? I don't know. Let's see if we get some homeopaths that apply. If they do, we'll look into the statutes. Well, no, I'm serious. I'm open to it. Moreover, well, actually, I'm on that subcommittee. You know, if it's a homeopath that just rocks my boat, I'm there, but it has to be legal. I mean, you know. Did I answer your question?
Yeah, so I'm kind of glad you're related to my statute on this topic.
Oh, no, I suspect, again, I can speak for Texas with certainty. The Texas Medical Board is given very strict guidelines as to who can be issued a license to practice medicine, and that is statutory. I mean, I'm sure we could look it up. In fact, let's use AI. Glenn, I bet you, what are the statutes for licensure to practice medicine in Idaho? Anyway, thank you for your input, though. We are going to follow statute, hands down. Any other issues as it relates to this entire topic? Hearing none, let's go to the next topic, Director's Report.
Thank you, Chairman. This won't take long, but it will take a few minutes if the board will indulge me, simply because it's been a couple of months since we last met. And during that time frame, we moved through the end of fiscal year 25 and into fiscal year 26. So I wanted to bring the board up to speed on status of programs and funding that we have for FY26, because as you're probably all aware, a number of federal funds that we do receive are federal pass-through funds. And obviously a number of things have been happening on the federal level in regards to DOGE and staffing and MAHA and different. So it's all impacted the timing of funding to the health district and to the states. So I just wanted to take a few moments to share what I know so that the board is informed on that. Along those lines, just touching, I'm not going to go through every single program, but I just wanted to emphasize to the board that there are a number of programs that we have that have robust demand in services that continue and continue to grow, frankly. And if you look closely at I'd recommend that everybody take some time to look at their division reports. Maybe not right now, but take a look, because a number of the programs did put in summaries of fiscal year 25 services. We will have an annual report that's coming out that will go into greater detail, but I think it's important that the board take a look at the extent of services and what we do have going on in the Panhandle Health District. Just a few things to touch on. You know, we did over 2,800 inspections in the on-site wastewater program, septic permitting, over 1,600 inspections in our food program, child care inspections, public drinking water program inspections. I think we oversee about 200 public drinking water systems. Solid waste. The funding for that we get in environmental programs, we do get some federal pass-through funding for the public drinking water systems. That I think snuck in just before the end of the fiscal year, so in late July, similar to the child care program and our efforts in the Superfund site. That's a combination of pass-through EPA funding along with state funding to manage the programs there. But we did receive full funding there. We did see a reduction in funding in our preparedness program. I know prior to the meeting there was some discussion of our public health preparedness program, and that's our response to emergencies. We did see a decrease in funding there. That's a nationwide decrease. So we're looking on how we'll amend programs to get to that point. WIC services, we saw a slight increase in federal funding to WIC services. We are seeing over 3,200 clients in that program. We have 2 locations that we serve in Kootenai and Bonner County, and then at our offices in Shoshone, Benoit, and Boundary. Our home visiting program, this is the program where we assist first-time moms in low income or economic statuses. This really does feed right into Director Adams of Health and Welfare's goal of getting as far upstream as possible to keep families together and to provide assistance in new mothers with lactation services. Just holistically an effort to keep families together and have a healthy outcome. So there's a lot of support for that, both on the federal level as well as on the state level. We get a combination of federal and state funds for that. We did receive full appropriations there. We are actually investing some district support into that, some county funding into that as well, because we do believe that that's important. And it's been expressed by a number of commissioners, sitting commissioners, that it's important that we focus on those programs. In our communication and health promotions programs, in which we have opioid settlement funds, we do have hired Holly Graham. She's looking into evidence-based prevention programs. So we're going to expand our reach to providing education to the communities on opioid and fentanyl use, or frankly, the avoidance of such use and the risks associated with that. Our Fit and Fall, our vaping program, senior companion programs, and in our FE services, we did receive full funding for general FE and which were both federal funding sources. In clinical services, we did receive, it's been interesting in Idaho that with some of the rules that have come out in recent years, we have not met the requirements to apply for Title X family planning funding. The state did cobble together some Title V funding, which they provided to us. It's one-time funding. We're to support family planning services. We did receive the Women's Health Check funding, HIV case management, TB. We have not yet seen immunization funding. That is funding that does come through from the federal government. So we're not sure where that's exactly at yet. One item that I did want to share with the board that's come to light in the last week, in the last 2 weeks, more information, and frankly, it's fairly new information to me. And this is follow-up to the workshop that the board had on clinical services. And as you know, that part of that is driven by the board. Part of that is the legislative intent that clinical services, or the pass-through federal funding for clinical services, be passed along to be redirected from the health districts and to the federally qualified health centers, similar such as Conixu Clinic or Conixu Health Services and Heritage Health. As of 2 weeks ago, at that point, my understanding was that neither the health districts nor the FQHCs had been discussed with them in a broader sense. That has happened. My understanding is that a number of those federally qualified centers are interested in receiving that funding, including Heritage Health here locally. I've not yet been able to get in touch with Kevin Nepper, who is the CEO for Nixie Health Services, just to understand what his interest is with the funding. To share with the board, the other piece of information that came to light recently is what funding did the legislature intend to be redirected? Because within the bill, it simply states clinical services. Well, health and welfare and the director was going to go back to JFAC and ask for clarification on that. And the clarification that they came back with is that the funding intended to be redirected is family planning funding, women's health check funding, immunization funding, as well as communicable disease, STI, disease treatment and prevention. I don't have a slide up today, but if the board recalls at that meeting, that is essentially 5 of the 6 services that we provide in clinic, the 6th being general primary care. So to give a sense of what that would look like for our budget, if that funding was redirected, for fiscal year 26, we have about 1.75 million set aside for clinical services. Of that, around about $1 million is anticipated in self-pay or insurance payments. About 350 to 400,000 of that is this pass-through funding that is looking to be redirected, and then there is county support of $360,000 that's put into that. So we're looking at a potential decrease in funding of around 23 or 24%, which would be significant to our ability to operate clinical services. Really, I'm giving this information for your consideration for the August meeting, but I did want the board to be aware of that information that literally just came to light in the past two weeks or so. Yeah. That's correct. That's correct. We do not. We do not. It appears to be, an intentional effort, by the legislature to move this money from the health districts to alternative sources. Well, not alternative, but specifically federally qualified health centers. There is discussion, and another item for the board to consider, that there aren't federally qualified health centers in every county in Idaho.
But they are in all 5 counties of HD1.
Yes, in one degree or another. I believe they have limited services in Benoit County. But there are questions that in some regards, like the example provided in Ada County, in some of the larger areas, larger population centers, some of those federally qualified health centers have such significant budgets, in the tens of millions or more dollars. Receiving $200,000 to provide family planning services may not be something that they're interested in having. So you might start seeing some inconsistencies in access to care. So that's not something that I have the answer to. I don't know what the future of that looks like. Certainly we can discuss this in greater detail in the August meeting, but I simply wanted to share that information with you. 2 other points that I wanted to bring to your attention is that bill obligates the Idaho Department of Health and Welfare to develop a transition plan on moving that funding. And the deadline outlined in the bill is January 4th. My understanding in talking with representatives from Health and Welfare is that they intend to have that plan developed. I believe Director Adams wants that plan developed early this fall.
He's no longer director.
I keep waiting to hear an update on where he's at.
In Washington, D.C.
I knew he was selected, or he was.
And he's left. There's a new director.
Okay. interesting. I literally had a call with Health and Welfare on Monday, and that had not been relayed.
Well, now I'm not buddies of his. Didn't get this from him. But Sage Dixon, who is a buddy of his, tells me that. But what do I know?
So I just wanted to share that information. If the board wants more information, I'll certainly be prepared for the August meeting. But I wanted to share that for consideration by the board in moving forward.
Thank you.
Then the other item. Oh, any questions?
Yes.
Yeah, is there any?
Each funding source is a little bit different as far as what we can use that funding for. So I would expect, yes, some services or administrative aspects do tap into that funding. Well, Chairman, the other item that I just wanted to touch on, because it's on my report, is the lawful presence. The legislature made changes to that statute this last session. They removed a number of items, and the short version is that it's a enhanced effort to verify that public benefits are only being provided to U.S. citizens and not those of immigration of inappropriate or that aren't citizens of the country or have another appropriate immigration status.
Well, update it. Did that law pass?
Yes.
It did pass. Okay, I was involved in the discussions of it. I didn't. Okay, so
to share, if anyone comes to the health district, and some of the changes they made were specific to services, health services offered by the health district. Probably the largest one was the WIC services, but also in addition to that, clinical services. And frankly, the way it's drafted, it also applies to pretty much most of the services that we provide, there with some exception. And the requirements that if they're seeking a public benefit, including professional licensure, that falls in there, which is what pulls environmental services in, is, as an individual, if they're a business or have otherwise been vetted as a U.S. entity, then we don't have to take any further steps. If they do come to us as an individual and they're requesting a professional license or they're requesting public benefit, at that point, we do have to require an ID. We have to be provided with a social security number, and we have to have them sign an attestation stating that they are a U.S. citizen. So part of the reason to bring this to the attention of the board is not just to mention that we are in compliance with this new requirement, but also if you do hear from constituents, certainly Commissioner Korn, that there's these extra requirements at the health district, and it's related to this. This is where it's coming from. One of the things that I will share is we've had multiple conversations with program managers that we're doing everything possible to recognize that in North Idaho, predominantly, we're going to be dealing with U.S. citizens. So we're making every effort to streamline, to comply with the rule, while at the same line, not hanging anybody up in any application process. But it is a change in operations and a change in doing business that I felt that the board should be aware
But
of.
since you singled him out, my favorite Indian restaurant in downtown Sandpoint, I hope they got certified. It's good food.
And to some degree, Mr. Chairman, we do have some latitude because in environmental services, most of the food licensing happens in November and December, and the septic system installer licensing happens in January, February of the year. So we're hoping that the kinks will be worked out and there's some clarification so that can move as smoothly as possible. Because to be perfectly candid, I don't like giving my social security number out. And if I was someone coming in for an environmental service, I would not be comfortable with that. My understanding in talking with WIC and Clinic, it's not unusual to seek a health service and be asked for that information. In meetings with the other health districts so far, it's been fairly smooth, but just wanted the board to be aware.
Is there any like alternatives to social security number that they allow, or like when you go through, there's qualities of identification, like a passport or passport cards, like counts for everything.
If I'm not mistaken, the big beautiful bill has provisions for e-verify.
Okay.
Are there others who can weigh in on this? I think that's a true statement. Glock will know.
Well, and Mr. Chairman, if I can, that's a point. There is a federal program called SAVE. I don't remember what the acronym stands for, but that was going to be an alternative means of validating legal status. What I will tell you to date is we're kind of using District 3 as a test subject to work through that process because they're paying their attorney to fill out the application to have access to that system. And they started the process in early June, and they're still getting pushback on whether they have the legal standing to have access to that system. Because our thought, and the other health district directors are, once they figure out what information needs to be fed to the federal machine in order to grant us access, once they figure that out, we'll just mimic that information because we're all citing the same statutory authority. So yes, there is a plan in place for that that's working on it.
Okay. Yes, sir.
Can I ask if that, these processes necessary for private citizens if they're
And the short answer to that is no. We looked into it and it's fairly, the rule is fairly broad. However, it speaks and it references U.S. code, but it speaks specific to professional and commercial licensure. We view a permit to install a system as not a licensure, and thereby, and legal counsel has agreed. I'll be honest with you. One of the things that's been a frustration with this is that this was put into place, and then the direction from largely from health and welfare was, well, if you have any questions, take it to your legal counsel. And the frustration that I have with that is you send it out to 7 health districts to take to 7 different. Not only is there a cost associated with that, and we did coordinate so that we weren't, we tried to minimize that cost, but I can tell you that there are slightly different interpretations that have come from the different attorneys. And so I expect, so I expect that, there will be some refining that occurs, but I just want to assure the board that we're going to make every effort possible to make this as streamlined as possible for the citizens of the county.
Do you anticipate any additional cost associated with kind of implementing this or no?
I at this time I don't anticipate a cost other than potentially some additional time if there are individuals that come in and they can't, and they're requesting a service and they can't demonstrate lawful presence, they might have to come back later. So there's but not an upfront cost per se. Chairman, that's all I have.
Okay. Does anyone have any other comments? Editorials, I'm open. I know it's not on the agenda, but you know me, I love to talk. Yes, sir.
I'd like to say one quick thing. We can get a fee that is not citizen to that.
They can.
Yeah, they can.
So by acquiring a good number, maybe it may not actually qualify. Suffice whether or not you are a citizen or not.
And Mr. Chairman, to that point, there has been discussions and frankly, there is a lawsuit right now against the state for that, specific to AIDS treatment, so really doesn't impact us directly. But my understanding is that the state legislature created, they created this process, and when we sent it to legal, we said, just tell us if we're being compliant with the law as written. You know, because there is a larger question that there are multiple ways to be in this country legally other than having a social security number and a valid ID. So we'll see where that shakes out. We're not party to it.
My suspicion is that there are a number of unsettled issues. You just brought up one. Actually, I was privy to one of the conversations regarding when this bill was still in discussion phase before it had been passed. And there were discussions as to how to navigate the Impala laws. So strictly speaking, a medical provider or hospital has no option but to treat a patient if it's an emergency. Who gets to define emergency? I'm just putting it out there. This is not a straightforward concept. So to be continued. I don't know what the answer is, but it's going to be discussed some more. But it's not specific to us. This is the whole doggone country. Anyway, anyone else? Do I hear a motion to adjourn? We hear a second. Anyone object? Hearing none. Have a good afternoon. Thank you, everyone. Okay.